Now, to get the most out of surgery, of course you need to be on a diet. But I'm going to use diet in a different sense than you're probably used to. Diet usually is one of those four-letter words. It means pain, it means deprivation, it means wishing you could have this or that thing. But the diet that we're going to talk about with the help of surgery is all about conscious food choices and feeling natural with less eating. You actually can eat much less and have a normal energy level because the surgery is going to adjust your metabolism so that your body wants to help you lose this weight. So what does this mean? This means that you're going to have a smaller, more healthy appetite that's easy to satisfy. And believe it or not, we're going to want your new, healthier appetite to be your key guideline for when you decide to eat or not. So in other words, I'm going to tell you after surgery, if you feel hungry, go ahead and eat something. If you're not hungry, then don't eat anything. And this can be quite amazing because in the first month or two after surgery, our patients commonly go for 1 or 2 or maybe even sometimes 3 days without food because they don't feel hungry. And really nutritionally, that turns out to be okay because if they make the right food choices when they are hungry, then they'll get plenty of nutrition down the road. So the key point here is that the surgery is not going to eliminate your appetite. It's not going to block your ability to eat. It's just going to give you a smaller, healthy appetite, and your body still will let you know when it feels the need for some nutrition. Okay, let's put this into practice. So what we're going to ask you to do after the surgery is we're going to ask you to eat from 0 up to 3 meals per day. So that means if you're not hungry, you don't have to eat. But you can eat up to 3 meals in a day, and we want you to eat healthy foods. Notice that we're talking about proteins, green vegetables. We're not talking about starches. We're not talking about sweets. And also, fruits are not on the list of foods to be chosen because fruits do, unfortunately, have some sugars in them. It seems to be the case that artificial sweeteners are okay in moderation, so NutraSweet, Splenda, those types of things to add flavor, that seems to work out all right. And then one of the key things that we want you to do is we want you to stay hydrated all the time. So this is a different story. I said that you should eat just if you feel hungry, but on the other hand, I want you to drink and drink and drink until you're making nice light-colored urine, and that tells us that your body's well hydrated. A good starting point is 64 ounces of fluid per day, but definitely we want you to watch what your kidneys think, and that's about the appearance of your urine. Now you've had surgery and you're a little bit hungry and you're making healthy food choices. We also have a particular timing that we want for your eating. So the one thing is that we don't want you to eat too fast. We want you to take at least 20 minutes to eat your 2 or 3 or 4 chicken nuggets because it takes the body 10 or 15 minutes to realize that you've gotten enough satisfaction and received those nutrients in your system. So try to eat slowly. The second thing is that we don't want you eating longer than about 30 minutes because for appetite satisfaction and for hunger satisfaction, you really don't need 45 minutes or an hour and a half. This is important because we see people who will sit down with a certain amount of food in front of them, and the tendency, a natural tendency, is to eat until they're finished. But that's not really the best thing to do. You want to eat until you're satisfied and then stop no longer than 30 minutes. Liquid intake can be a little bit tricky after bariatric surgery. One thing that we don't want you to do is we don't want you to drink with your food because basically you're taking your healthy chicken, turning it into soup, and it'll flow on through your stomach quicker than we really would like. What we'd like to have happen is that your chicken and your broccoli go into your stomach and they sit there for a little while and they give you a nice sustained sense of satisfaction. We call that satiety. And that happens when you let the food sit there and not be over moistened or like soup washing through. So to put this into really practical terms, what we want you to do is we want you to sip liquids all day long until you sit down at the table. And the first time you pick up that fork, we want you to push the water away and not drink with your food, and then also not drink for about 1 hour afterwards to give that food a chance to sit there in your stomach for a little while.